Hi, this is Dr. Jason Goodchild with Premier Dental, and I'm here talking to Dr. Timothy Bizga. He has a practice outside of Cleveland, Ohio, and I thought I might kind of check in with him, see how he's doing, what are the things he's doing in his practice to make sure that the business stays healthy, team stays intact, and that they're ready to go when the quarantine is lifted. And I thought maybe we'd do a little bit different for this talk with Dr. Bizga. Of course, we want to do some serious stuff and hit all that, but we also want to have some fun, do a little bit more of an uplifting approach as well, and then maybe we'll try and tie it up with Dr. Bizga's 3 or 4 or however many things he has that are kind of top of mind for him right now during this crisis. So with that, I'll say welcome, Tim, and it's great to talk with you this afternoon. Thanks for being here.
Good to be here with you, Jason. How are you and your family? Everybody good over on your end?
Oh, yeah. We're hunkered down, just like we've been instructed to do. Kids running around like crazy, not enough food in the house, enough toilet paper for the time being. We're doing well, thank you. How about yours?
Good. Same. We're trying out being a teacher. Man, can I just give a shout out to the teachers about how much appreciation I have for all of them around the country and all that they do. And this is a great wake up moment in America for appreciation for teachers. I'll say that.
Absolutely. So I thought a good place to start was to, what's the state of affairs with your practice right now? What are you guys doing in Ohio?
So Ohio has been leading the charge. Governor DeWine and our Chief Medical Officer, Dr. Acton, they've been leading the charge in aggressively pursuing the agenda of the White House, the social distancing program. And as of midnight tonight, 11:59 p.m. to be exact, we are on full shutdown, which means they are telling everybody to stay in their homes unless for the necessary trips out, like the grocery store or to care for a loved one. And I love that they put walking dogs is allowed. So if you have a dog, it gives you access outside, at least in Ohio.
Yeah, and so that follows with your practice. So you're basically shut down. Are you doing any emergency treatment, or how are you handling that if someone has a problem?
So thanks to the relaxing of teledentistry and the HIPAA compliance and all the things that have been taking place over the past week, most of what we're doing is teledentistry. We're taking calls and FaceTiming with patients. Fortunately for us, the shutdown for us occurred a week ago. We closed on Monday when we knew, sort of signaling from the state, they had made a request, and then the request got stronger by Tuesday afternoon. And I believe by Wednesday, most of my colleagues in the Ohio area were fully closed other than for emergency treatment. So we've been in the process of a week of shutting down, moving patients. That is an undertaking, because when you are shutting your practice down, as you well know, you were an owner of a practice, Jason, you have hygiene booked out for months. And it creates this vacuum where what are you going to do with those people? So we've created a checklist of people that we canceled and we moved. We definitely canceled for 3 weeks. They at least said 3 weeks here in Ohio, and then we'll reassess. In fact, the order that came from Dr. Acton was until further notice. So we are literally on standby, waiting for when we can reopen this economy.
How are you communicating with patients? If it's a to be determined kind of date when you guys going to get back to normal, do you have any website stuff or social media stuff, or any plans to communicate with those patients in the interim?
So a lot of what we've been doing is been analog, old school, picking up the phone, calling people, because it's one thing to make posts, and I love social media for all the benefits. Certainly all of us are enjoying its usage during this time where we're on lockdown in our homes. So it's a blessing. But when you see your patients and you develop these relationships, a lot of them have questions and they look to you as a healthcare provider for guidance. And so we've been taking the approach of picking up the phone, systematically going down the schedule, calling, and then answering questions. I know I spent a good deal of my Monday a week ago doing that, where I was talking to patients, telling them why we decided to delay, how I felt that it wasn't wise. They were in the high risk category, and until further notice, let's just hold our collective breath, take a pause here,
Yeah.
and that's how we're going about it.
Yeah, I know. The dentist in me, also, the potential patient in me, kind of thinks that's a wonderful idea. That personal touch, I bet, means a lot to those folks, and I'm sure they're looking forward to a time when they can get back in and see you. Um, I was also thinking about your team. I know it's hard for everybody, as a potential business owner. Protecting the business, making sure patients are taken care of. But also, you just mentioned before we started this conversation today about, you have a close knit team and people have been together for a long period of time. So one of the other things that I know you are going to be tasked with during the shutdown is communicating with team, and then maintaining your team so that when things do kind of lift, that you can hit the ground running again and be a business again.
It's a great point. I mean, these are unprecedented times, Jason. We've never seen anything like it. I hope I never in my lifetime have to go through something like this. It's literally everybody I've watched over the past 2 weeks go into survival mode, and everybody is sort of pulling back in, figuring out where they're at, taking assessment of the landscape. How long will this last? How long can we go before we start to have trouble? And many of us are left with a lot more questions than we are answers at this point. But what we're doing is we're keeping in touch with the team,
Yeah.
talking to them on the phone, and Facebook has been really good for that because many of us in the office are on Facebook, so we can stay in touch that way and everything. But right now, I'm in, like many of you, of those who might be listening, waiting and hoping for some answers to come and give us some clarity, because I think the big issue with this, it is an invisible enemy. We can't see it. We don't know who has it. And we don't know if you are going to potentially become critically ill because of it. And we're starting to see more and more reports that it doesn't just affect those who are older and critically ill, but there's some younger people that are getting, we don't have enough data, of course, but that's why we're doing all these measures, right? We just don't know. And I think a little bit of prudence is good, but it certainly is a scary time.
Yeah, watching, waiting, learning, but
Mhm.
also planning, I think.
Yeah.
Planning for a time when you're ready to get back to normal, or we hear that it's safe to get back to normal. Anything that you're kind of doing or thinking about, noodling on right now that you have to have in place to get yourself up and running and ready to go again? And from your team, from the office, from supplies to calling patients, anything?
Well, there's so many questions right now. So the big one that I'm sitting here asking is, what is our new normal going to look like? I mean, I remember watching the video, What If Saliva Were Red, when I was in dental
Yeah,
school. Do you remember that? And
absolutely.
I I remember that moment where I went, oh, hell no. I am not doing this. If this is what it means, I am not going to do this. But then, like, they discussed PPE and how universal precautions and all these things. And this has been our normal, right? Like, you and I, we've been trained for this. Like, I feel like most dentists, my initial thing was, man, this is what we've been, our whole training has been around. We treat everybody walking around like they have something every single day that they come in. Um, but with this, coronavirus and everything that you're seeing and the reports coming out of Europe, there's a lot of question marks on what normal clinical daily practice, for what it's worth, that word normal, will look like. And so I know a lot of people are saying, well, prepare, and that my mindset right now is uh, get some things in order for the shutdown. I think many people are underway with that, and protecting assets and making sure you have those things. That's sort of where I'm at. And then I've been really focusing in on this PPE stuff. What are we going to be required? What is OSHA going to say after this? What kind of masks are going to be standard? Are we going to be required to have some sort of surgical filtration units put into our offices, just to give peace of mind to our patients. So I'm not there yet, to be honest. I'm
Yeah.
not. I'm not there. I'm not there on what it's going to be like going back, because there's still so many question marks about when that will happen and what it's going to look like in terms of a new normal.
Yeah, you bring up standard precautions, and we as dentists have always been there since the HIV and hepatitis.
Yeah.
The idea of just assuming that everybody has something and we're going to be protecting ourselves at all times. What will that new normal look like? I don't know. Again, maybe one last question, and then we'll take a break. Is um, how long do you think it's going to take you guys to get up and running? Say, the quarantine's lifted April 1st. I think that's a little optimistic, but
Okay. Let's
April 1st.
pretend. Land
Uh,
of make believe. Let's go to the land of make believe. All right.
I guess that's a good question, right? From the business side of things, it's really incumbent upon the business health to be ready to get back to normal as quickly as possible. Do you think that if the quarantine gets lifted, that you guys can jump right back in? I mean, are patients going to want to come in? Is staff going to be ready to do
Mm.
it? Or are they going to be caring for kids or loved ones? Or do we think that there's going to be, just as like it was where we sort of slowed down, we're going to have to speed back up again?
These are great questions. And to be truthful, it's going to be probably mixed. I think we're going to have struggles in the beginning. This is just my personal belief. I think the struggle is going to be on supply. If you really listen to the pundits and believe what they're saying about the shortages of PPE and all the things that are going to happen come mid-April when this virus is supposed to peak its curve, then if we started back up, are we going to be able to get the equipment? What is it going to be mandated that we need to have for each patient? And then what is going to be the public's reaction to all this? Is there going to be the pent up feeling of stir craziness that I want to get out, I want to do things, I want to get back to my normal life? I think some people are going to move into that. I think others are going to be more reticent. I think they're going to kind of cautiously, maybe it's going to spawn new businesses, new ways of doing things, new thoughts, ideas, marketing campaigns. You know how these things go.
Yeah.
But I really believe that our industry is facing new normals, like HIV/AIDS changed dentistry in the 80s, where a finger cot that you occasionally would put on for a rough surgical procedure went away, and you gloved up, mask, gown where necessary, and universal precautions came in. I feel as though that may be what we face going forward. And there's a lot of question marks, because should we reopen? I believe there's going to be supply challenges with getting that equipment. And then there's also going to be a demand challenge, because getting the awareness out that we have these things. And in the beginning, I know many of our colleagues were like, don't shut down, because you're giving people a sense that we aren't prepared or we don't take precautions seriously in the first place. And you and I both know, we take it very seriously in dental. We're constantly thinking about protecting patients, cleaning surfaces, using better disinfectants that don't destroy your equipment, because a lot of the stuff we use actually destroys your stuff
Yeah.
over time. It shortens its shelf life. So we're going to have a challenge with public awareness and getting the message out. And hopefully the White House and their team, with as much as they've come up with their charts of 15 days to bending the curve, they give out guidance to the public about it's safe to go back to your doctor, and here's why. So I'm hoping that they take as much effort as they've done in shutting things down as they
Yeah.
do helping us to get it back up.
Yeah, I agree. So many questions. So many questions. Not a lot of good answers
Yeah.
yet.
Yeah.